14 things you think cause heart disease but don't. When it comes to heart disease, the media is full of advice on what you should avoid to keep your heart healthy. But as medical knowledge advances, some of the things we once thought were gospel truth are being proven wrong. It's time to separate fact from fiction and rethink what we know about heart disease risk. 1. Fat will give you a heart attack. For years, fat has been demonized as the ultimate heart killer, but it's not that simple. Not all fats are created equal. Good fats, like those found in olive oil, nuts, and avocados, can actually protect your heart. On the other hand, saturated fats in meat and full-fat dairy should be consumed in moderation. While trans fats are the true villains. Trans fats, found in many processed foods, are formed through a manufacturing process that makes liquid oils solid at room temperature. 2. Eggs are bad for your heart. Egg yolks have long been shunned by the cholesterol conscious, but new research suggests that eating a whole egg a day might actually be good for your heart. A study conducted in China found that individuals who ate eggs daily had a lower risk of heart disease and stroke than those who rarely consumed them. So, if you're worried about cholesterol, focus on a heart-healthy diet rich in fiber and healthy fats instead of avoiding eggs entirely. 3. Red meat is a no-go. Red meat has had a bad reputation for years. But recent research is showing that it might not be as bad for your heart as previously thought, especially when it's lean and unprocessed. A Mediterranean-style diet, which traditionally includes lean red meat, has been shown to improve heart health, even for those who are overweight or moderately obese. 4. The number on the scale is all that matters. Obesity is often touted as a major risk factor for heart disease, but the story is more complicated than just weight. This concept suggests that being super lean can sometimes be more dangerous for your heart than carrying a few extra pounds. The real threat lies in visceral fat, the fat that surrounds your organs, rather than the fat on your hips and thighs. You could be lean on the outside but still at risk if you have high levels of visceral fat. 5. Marriage is stressful and bad for your heart. If you've ever joked that your spouse is going to give you a heart attack, think again. Numerous studies have shown that being married can actually improve heart health, but the quality of the marriage matters. It's not entirely clear why, but it could be that supportive spouses help each other stay healthy, or that men who are committed to a long-term relationship may have other positive health habits. 6. The salt shaker is your worst enemy. Salt has been blamed for increasing the risk of heart disease, but it's not the salt shaker you need to worry about. According to the American Heart Association, AHA, more than 75% of the sodium in our diets comes from processed, prepackaged, and restaurant foods, not from the salt we add at the table. While it's still important to watch your sodium intake. 7. Testosterone replacement therapy will wreck your heart. As men age, their testosterone levels naturally decline, and some turn to testosterone replacement therapy, TRT, to regain their youthful vigor. In 2015, the FDA warned that TRT might increase heart risks, leading to concern among patients. However, more recent research suggests that TRT, when prescribed appropriately, may actually benefit heart health in older men. 8. Your lifestyle habits are the only factors that matter. We've been conditioned to believe that heart attacks are solely the result of lifestyle factors like high cholesterol, high blood pressure, diabetes, obesity, and smoking. While these are significant contributors, Dr. Mehta points out that only about half of heart attacks can be attributed to these risk factors. Inflammation, rather than traditional risk factors, may be the smoking gun behind many heart attacks. 9. Only men need to worry about heart disease. Heart disease doesn't discriminate by gender. It's the leading cause of death for both men and women over 65. While men are more likely to experience heart attacks at a younger age, women's risk catches up after menopause. 10. Heart attacks only happen to old people. Think you're too young to worry about heart disease? Think again. Due to the rise in childhood obesity, conditions like high blood pressure and type 2 diabetes, once seen only in adults, are now being diagnosed in children. This means that the risk of heart disease is starting earlier than ever. 11. If you hate seafood, you're doomed. The AHA recommends eating fatty fish like salmon and mackerel at least twice a week for optimal heart health. But if seafood isn't your thing, don't panic. You can still get your omega-3s from plant-based sources like flax seeds, chia seeds, and walnuts. 12. Exercise is dangerous for those with heart disease. It's a common misconception that people with a history of heart disease should avoid exercise, but this couldn't be further from the truth. Regular physical activity strengthens the heart muscle and improves overall health. As long as your doctor gives you the green light, exercise is one of the best ways to lower your heart disease risk. 13. Sex is risky for your heart. Most cardiovascular events don't occur during sexual activity because it typically doesn't last long enough to strain the heart. However, erectile dysfunction, ED, can be an early warning sign of heart disease. ED may indicate poor blood flow, which could signal trouble in other parts of the body, such as the heart and brain. 14. Alcohol is either good or bad, no in between. When it comes to alcohol and heart health, the truth is somewhere in the middle. Excessive drinking can raise blood pressure and increase levels of harmful triglycerides, but moderate alcohol consumption, particularly red wine, has been associated with heart benefits. Heart disease is complex, and as our understanding of it evolves, so too must our approach to prevention. Remember, it's not about avoiding everything on a bad list, but about making informed choices that promote long-term well-being.